Thanks. President Biden continues to push for a cap on insulin prices. Now that millions of Medicare customers are seeing reduced prices for their diabetes medication, other drug companies are beginning to follow suit.
Western Mass News reporter Reagan Lockery is getting answers on how this will benefit the health and quality of life for those with diabetes here in Massachusetts.
Insulin is required for life. You know, this is not a luxury drug. This is required for life, and children and adults die from diabetes not being treated.
As part of President Joe Biden's Inflation Reduction Act, nearly 4 million seniors on Medicare with diabetes start to see their insulin costs capped at $35 per month this past January. And now other pharmaceutical companies are following suit, allowing those without Medicare beneficiaries to also reap the benefits of affordable insulin. Just this month, Eli Lilly announced they are lowering the cost of insulin by 70%, capping what patients pay out of pocket for insulin at $35. Meanwhile, the president continues to call on Congress to finish the job and cap costs at $35 for all Americans. Western Mass News spoke with Dr. Charlotte Boney, pediatrician-in-chief at Bay State Children's Hospital, about this.
Of course, hearing that some pharmaceutical companies are going to reduce the cost of insulin warms our hearts. It's about time, right? And will it be enough?
The high cost of insulin has led to many patients having to ration their doses. And although this isn't recommended, Dr. Boney explains to Western Mass News some patients have no choice, a struggle one Western Mass resident knows all too well.
You're always wondering when you're going to fall in a coma because if your blood sugar is high.
So if you're an adult and you run out of insulin for yourself, you ration it. If you're an adult with a child with diabetes, then that means you're doing everything you can to get by with the barest amount of insulin for your kid. And that means you're cutting out something else. You're not paying the rent. You're not buying enough food. You're not buying gas for your car.
Holyoke resident Zabita Sabdani tells us she's had to put off retirement to afford her vials, along with the other meds needed as a diabetic.
I can't afford to retire. You know, it's too much.
Dr. Boney says when children and adults don't get enough insulin, they end up in the hospital if they're lucky. She adds in the last 2 weeks alone, she's seen 2 children in the pediatric intensive care unit due to a lack of insulin.
We had a family with a kid with new onset type 1 diabetes. The out-of-pocket cost to her was $400. So she was not able to buy the insulin for her child.
Boney adds typically those who can't afford the medication become regulars in the ER, putting a strain on the healthcare system. And not only is insulin a life-saving drug, Dr. Boney says it helps lower the risk of developing complications like cardiovascular or kidney disease down the road. Reporting for Western Mass News, I'm Reagan Lockery.